Hello, Mr. Ellis, how are you today?
I'm doing well.
Okay, I'm Ms. Ellis, and I'm gonna, funny, we have the same last name. I'm gonna be your nurse today, and we're gonna be doing a physical assessment on you. Stop, you're gonna be good now. Okay, and
I
we're
never
gonna be,
promised.
we're gonna be, checking your, skin, listening to your heart and lungs, and just checking you all over to make sure you are healthy, okay? Is that all right?
Yes.
Okay, so wash my hands.
She washed her
The
hands.
first thing I'm gonna ask is, are you in any kind of pain today?
No.
Okay, and if the answer was yes, then I would do the pain scale, right? Okay, so, can you please state your name and date of birth?
Charles Ellis,
Date of birth,
5/27/56. Don't laugh.
okay. Okay, and, can you tell me, where you are, please?
In a big room.
Okay, he's not,
I'm-
but where is this room located?
UTMB.
Okay, thank you. And why are you here today?
Because my wife asked me to come
They're
here.
taping this.
You wanted actual
Okay,
answers?
all right, all right.
If I gave you something other than that, I'd have an altered LOC.
Okay. All right, so, okay, so what we're gonna do now is I'm gonna start by, I'm gonna check your head, and I'm gonna look at the things on your head and your eyes and your hair, okay? And so I'll need to touch you, and so I'm gonna put gloves on, just in case.
Has anybody, while you're in the hospital, noticed nurses putting on their gloves to do this stuff?
Only if there is an open lesion.
And you don't have to accept, if I didn't know him from the street, he might have lice or something, and I've got to. I wanna put my
That's
glove on.
true.
So I'm looking, his hair is not too dry, it's, clean, his scalp, there's any pain when I'm touching your scalp, sir?
No.
Okay, no pain there, and I'm gonna come around on this side as well and look really closely and make sure you've got one little scar there, but no bumps, no lesions.
Tell me where your scars are, I can't see you.
Oh, I'm sorry, one scar in the, left, I guess it's the occipital area. Yeah, left occipital toward the forehead. It's an old scar, and it's white, and it's maybe about, 1 centimeter long? Okay, and I don't feel any bumps or nodules, and no pain, right?
Right.
Okay, so.
1 centimeter long?
Yeah, and it's an old scar that's healed. Okay? So now I'm gonna touch your ears. Any pain there when I touch your ears?
No.
Okay, any pain on this one?
No.
Okay, any pain when I do this?
No.
I'm pulling your ear back and up a little bit. Any pain on this one?
No.
Okay. So then I'm going to look inside your ear a little bit and make sure there's nothing in the ear canal. We're not gonna look at the temporal, the membrane there, the eardrum. Okay. He's got one freckle on this ear. No drainage, no dryness, no lesions. He's got a few hemangiomas, okay, that's scattered throughout. Alrighty, okay. So, all right, now what I want you to do is, turn your head toward me, just your head. And- Pardon?
Is this head normal cephalic?
Oh, yeah, normal cephalic. I don't know, you might be a little large, but there you go. Anyway, okay, so normal cephalic. And turn your head to the left without moving your body, okay? Now down, and then back to normal. And then I want you to go with your chin down, left to right, please. Okay. Do you have any problems with your neck or neck pain?
No.
So normally I don't have them like that, just in case there's something going on there. Okay. And then, let's see, what else? Oh, yeah. Yeah, okay. The other thing I wanna do is I wanna inspect his face, and I'm gonna check his skin as I go. That's what I like to do. And so far on the head, he's got some freckles, he's got, a few scattered hemangiomas, which is normal as you get older, a few skin tags. Okay, normal pink color. And when I look at his face, it's, symmetrical, eyes are symmetrical, there's no, drooping on either side of the face. Nose is fairly straight, okay, and ears are straight, no sagging on either side, okay. So now, what I wanna do is, okay, then I'm gonna and I've done the skin, we'll do the nails in a minute, okay, so, we've done thus far for the head. The other thing, next thing I'm gonna do now is I'm going to check, his, face and his cranial nerves 5, 7, and 11. So what I want you to do at this point is, I want you to clench your teeth for me tight, okay, and open. Does that hurt? And
No.
close? Okay. And then, I want you to smile for me with your mouth open like this. Frown. Okay, and then, and that's cranial nerve 7, and then also I want you to open your eyes first and then try to close them, okay? I can feel it pulling, all right, and then back to normal. Now, lift your eyebrows, okay, thank you. And, then I want you to puff out your cheeks, like blowing up a balloon, and don't let me close it. So I should feel resistance there, so I've got some resistance. Okay, then, let's see. We did that one. Cranial nerve 11 is, I want you now to push toward my hand and look toward me, no, turn your head toward me, okay? And turn your head the other way, okay? So cranial nerve, 5 was intact, he was able to clench his teeth, no pain when when I palpated the temple and masseter muscles. Cranial nerve 7, he was able to smile, frown, and close eyes, not able to close eyes against with tight resistance, he was able to lift his eyebrows, and there was resistance when I pushed on his cheeks, okay? Which is what you wanna see. Okay, in cranial nerve 11, he was able to push against my hand with resistance, and I could feel good strength on both sides of the face and head. Oh, the other one now is, what I want you to do now is, I want you to push up against my hand, with your shoulders, I want you to lift your shoulders against my resistance. And he's able to do that, and it's equal. So shoulder shrug is equal and strong, and that's, also part of cranial nerve 11. So cranial nerve 11 is intact, as evidenced by him able to shrug his shoulders as well, okay? Now, we're gonna look, while I'm here, I'm going to check his carotid artery, okay? And I'm gonna check one side at a time, so now I'm on the right side and I'm gonna palpate for it. And as I was looking, I didn't see any pulsations, so that's good. Okay, it's palpable on that side, and then I'm gonna come on this side and palpate.
Do we ever do it together?
One side at a time, right? So they're both equal and strong, 2+, okay? And now what I want you to do, Mr. Ellis, is to, when I tell you is, I'm gonna have you, turn your head that way first, and when I tell you, I want you to hold your breath so I can listen, okay, and then I'll tell you when to breathe. So now I'm gonna auscultate the right carotid artery. Hold your breath for me. Breathe. Okay, that's good. Now, turn your head the other way. Hold your breath. Okay, no bruise heard, able to auscultate the carotid arteries as well. Oh, I'm sorry, breathe. Don't forget to tell your patient to breathe. So both carotid arteries are palpable bilaterally, and no bruise are heard and no thrills noted. All right, so now I'm gonna go back on the skin. I'm gonna start for skin turgor. Since I'm here, I'm gonna go above the clavicle, and I'm gonna pinch on you just a little bit, sir, and make sure you've got good skin turgor here. And it is, it springs back real tightly, so the skin turgor is good, okay? And then, let's see, oh yeah, I wanna check his nails while I'm here. Let me see your hands, please. Capillary refill is less than 2 seconds, okay? And then I'm still checking skin as I go. Let's take one arm out, please. Alright, that's good. I'm still checking the skin. He's got a few little, what do we call them? Lay term is age spots, but it's little crustaceans, and they have a name for that, but I can't. Anyway, they're like moles. We'll just call them moles, cause we're not sure, and some more hemangiomas there, okay? Okay.
Lymphoma?
No. It's normal for aging. And skin, a skin exposure. Okay, is that one? Alright. Oh, I know what I need to do before I get to this. We'll leave that there for now. Okay, let's, look at your eyes right now. I'm gonna pull down and check his eyes. His conjunctiva is pink, not too red. His sclera, I'm looking at it, it's a clear, a little pink, but not bad. That's norm for him, I happen to know. And his eye color is blue. Now, what I want you to do, could you dim the lights for me, please? I'll turn them off. I want you to look straight ahead for me, and I'm going to, check his pupillary reflex, okay? And look straight ahead, and I'm gonna check this one, and this one, and that's direct, and then I'm also gonna check for the indirect. Is that one? Yes. And then I'm gonna do this one and see, they're both, pupils are equal round and reactive to light, direct and indirect, light. Oh, and I'm gonna look, he's giving me a hint up here. I don't see any nystagmus. Look straight ahead for me and stare at something. There you go. And then also, what I need you to do is look straight ahead at my pen light, please, and follow it as I bring it in, okay? Okay, and he crosses. Okay, while we're here, I'm gonna go ahead and do the 6 cardinal gazes since I'm at the head here. But like I said, if you want to, you can do all these at one time, but I like to go ahead and go. So, what I want you to do is follow my pen light for me, and with your eyes only, don't move your head, okay? So. Okay. Don't move your head, please. Okay, good job. So,
Normal reflex is to move the head if they move the pen light too far,
yeah.
which is what I was doing when.
Stop. Okay, okay. So that was, for cranial nerve 2, we need to check the, use this chart right here. Let me find it. Here it is. This little chart. What I want you to do is hold it about 14 inches from your eyes, and I want you to read the smallest line you can read for me.
63925.
Okay, the other one is if they can't read English or can't read, okay, then you use that. 63925, okay? That's with both eyes. Now, what I want you to do is, I want you to take this and cover one eye, leaving that covered eye open, and do the same, read the one you can read again,
63925.
okay? And change eyes, and do it again.
426364.
4, 2, 3, 6, no.
No. 63925.
So he's,
I tried to get one right below it.
okay, well, don't show off, okay. Also, when I did shine the, light into his pupils, they were both equal and reactive to 3 millimeters, okay? Okay, this one says 2050.
What was his acuity?
Okay, his eye acuity is 20/50, both eyes,
Without reading it.
without glasses, yes. Okay. And then, we got the, extraocular movements, cranial nerves 3, 4, and 6 are all intact. He was able to follow the pen light in the 6 cardinal fields of gaze, no nystagmus, and pupils were equal around and reactive to light and accommodation, and they constricted to both pupils constricted to 3 millimeters. So we turn the lights back on now, okay. Let's see. ears already, so I kinda did the ears out of order on your paper, but I did them. And looked for the shape, and I pulled it up and back, and there was no pain there in the ears. Internal canal had no drainage. Oh, now what I'm gonna do, sir, is I'm going to, hold my hand over your ear, and I'm gonna whisper, a word, and I want you to tell it back to me, okay? Repeat it.
You
Didn't hear.
Oh, you didn't hear?
You do the other side, you
Oh,
hold
I'm
the
sorry.
other side.
Other side.
There you go.
Ay.
That's right. I had to stop up there.
And then you
Okay.
put your hands like that.
Faithful.
No, he's, see, you don't listen like I always said. Okay, right ear, he was unable to repeat the word. Maybe he couldn't understand me. Okay, let's do this side.
Baseball.
Okay, left ear, he was able to repeat the two-syllable word. Okay. Right ear, he wasn't. Okay, and you could repeat that, especially if they didn't understand you, okay? Because we all have different accents, so. Okay, all right, now we're gonna look at the nose and then the, nostrils, and we're gonna check also cranial nerve 1, which is the sensory nerve to smell scent, odor. Okay, so what I'm gonna do now is I need to look in your nose, please. Just be normal. Okay, breathe through this one, and then this one, okay. Any problems breathing through either nostril?
No.
Okay. What I want you to do now, sir, is close your eyes for me. Okay, and I want you to tell me what the scent is. Breathe.
Roses.
Okay, let's try this side.
Roses.
Bad sense of smell.
Smells like roses.
So we'll try another one.
Let's try another one. It was actually cinnamon.
Smell like roses.
Okay, shut your eyes again, please. Let's try this again. Breathe in. What you got? I just wanted to see if the scent was there. Let's try it. What you got? Try this one.
Smells like garbage can.
Okay. There's some they're common sense.
Okay.
It's garlic.
Strange garlic smell.
Okay, let's try this one. Huh?
Maybe he's gonna bring you a dozen roses.
That's it.
That smell like garlic.
Oh, let's do this one. He should know this one. I know it. Oh, yeah. Okay. Close your eyes again. Let's try one more time. Smell.
Mm.
Do it again. I'll tell you what, you take your left hand
Yeah.
and close your left nostril,
Okay.
and then I'll have you breathe. Shut your eyes. Breathe.
That smelled like garlic.
Okay, he's failed this test. We need to have him referred further on about his smell. That was actually coffee. Okay. So then we probably need to get some-
Refreshing our senses and the
Yeah, I
thing
was gonna
problem.
say, maybe
And the
the
other,
tubes are old.
pardon?
Maybe the tubes are old.
And that's
No,
possible.
I can smell it,
Oh.
but no, I know what they are.
Does he
So I'm gonna look
have
again to
an
make,
issue with scents?
huh?
Not scents, but does he have an issue with smelling?
And that's what yeah, do you have trouble smelling things?
Usually no.
Okay, alright.
So you didn't smell the coffee?
No. It smelled like the garlic.
You didn't wake up and smell it?
They all
Um,
smell like garlic? He said
Two
the
of them
garlic,
smell like garlic, the cinnamon smell like roses.
and then he said the garlic smelled like trash.
Oh, it did.
Okay, alright, so now I'm going to check your, mouth and, teeth, okay? So, my tongue blade, and I promise not to gag you too much. Okay? I'm not gonna gag you, I promise, but I will be me putting this tongue blade in your mouth and looking, okay? Okay, so will you open your mouth, please? And let me, I'm doing, mouth and throat. So cranial nerve 2, I guess, has some problems, so we might need to try different scents. Okay, open up, let me check. I'm checking the uvula in the back of the throat. He doesn't have tonsils, so that's negative. Look down for me so I can see, okay? And I'm gonna check his gums with my gloves on, of course, and his teeth. He's got several fillings, but all his teeth are there. His tongue let me see your tongue and stick it out, okay? Good, he's able to stick his tongue out, no extra grooves, no discoloration. Yeah, so cranial nerve 12 is intact, he's able to stick his tongue out. Okay, look at me and say, ah. The mucosa's moist, and, lips are moist, and, no dryness or lesions. Okay, now, I'm looking down here, and then I'm gonna go here. Okay, gag reflex is intact.
Thank you.
Okay, let me do this one more time. Say ah. Okay, it did move back there, even though, y'all, if you come look at him, he does not have a uvula. No uvula, but where the uvula connects does move. Okay, he had it removed because it helped with the snoring thing.
Right, okay, yeah.
So this goes in the garbage when you're done, but I'm just gonna stick it here for now. Okay. So cranial nerves, 9, 10, and 12 are intact. Patient said ah, and I can see the uvula moving. His quality of voice is a little raspy, but not bad. That's his norm. And he was able to stick his tongue out. Okay, so cranial nerve 12 is intact. Okay, and that's all my cranial nerves, I think. Okay, so I'm done with this. So now, sir, I'm going to listen to your heart and lungs, okay? And I'll start, I'm gonna move the gown down, and I'm gonna leave it covered, y'all. But in the hospital, I would do one side at a time. Just take your arms out of the sleeve, and you can hold it right here in the middle for now. So in the hospital, you wanna make sure they stay covered and remove one side at a time as you're looking. I'm gonna inspect first and watch him breathe, and I've been doing this all along, but I'm watching him breathe, and he's breathing normal in and out. Respirations are even and unlabored. There are no thrills, and when I have him lay down in a minute, I'm gonna check for pulsation. Sitting up, I don't see any, okay? And you're breathing well. He's not using any accessory muscles, okay? All right, just hold that there, and I'm going to listen. I listen to the heart first, just because what I like to do, but you're welcome to do the lungs first as well, okay? All right, so here's the clavicle. First intercostal space, second intercostal space. This is the aortic. Breathe normal. I'm gonna go straight across in the left intercostal space, left sternal border, alright, for the pulmonic. That's good. Okay, you can hold this side up over here, and I'm gonna come around to this side. 1, 2. Now, third intercostal space, Erb's point at the left sternal border. Just breathe normal. S1, S2 heard. No S3 or S4s. No rubs, no murmurs. So far. Okay, then I'm gonna do the tricuspid, which that was third, that's fourth, and that's fifth. Left sternal border. mitral, midclavicular, right there. If it's a lady, you're gonna ask them to move the breast out of the way for you. Okay, S1, S2 heard in all areas, no S3, S4s or murmurs. Rhythm is regular, rate is 76. I picked a spot, one of the spots to count. Also, let me palpate the mitral, the point of maximal impulse.
How long do you listen, or how long do you feel?
If I feel any irregularities,
No, I'm
at least a minute, I listen for a minute to at least one area, but I listen long enough till I hear it clearly. If I had heard an irregularity or irregular rhythm, I would listen for a full minute and count them. How many, dysrhythmias or irregular rhythm I heard, okay? Okay, on him, it's difficult to feel the PMI, so can I get you to lay down, please? Right now, since he's able, let me pull this out for you. Turn on your, left side toward me, please. Okay, and I'm going to palpate once again for the PMI, okay? And see where see if I can palpate it and feel it. And I can. At the fifth intercostal space with him laying on his left side. I was unable to palpate it with him sitting up, but I can now, and that's not unusual, typically, okay? All right, now you can sit back up. Lisa. Okay. All right, now we're gonna listen to your lungs, and this time, I'm gonna start in the front, you can move your nose and you have a shirt on. Normally though, I would cover them up the same way we just did, I would cover one side at a time and uncover one side and listen. So what I'm gonna do is, I'm gonna listen with my stethoscope in different areas in the front and also in the back, and each time I do that, I want you to take, not a real deep breath, just breathe in and out through your mouth for me each time I move the stethoscope. And if you get dizzy or lightheaded, let me know and we'll stop and rest, okay? Okay, so we're gonna start up here, just breathe normal through your mouth, in and out. Okay, again. Again. Okay, again. 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 Okay. Again. Again. One more time. Okay, make sure I'm not on a bone. Okay, again. Again. Okay, let's do this again. Again. Okay, and then I want you to raise this arm for me. Take a deep breath for me in and out. Oh, yeah, very good. Anteriorly, lung sounds are clear, all lobes. Right middle lobe is clear and able to hear it. Okay, now I'm gonna listen to the back. I'm giving him a few seconds to kind of recuperate from all that breathing. And I might have done more than 5, but you're gonna do at least 5 each side, right in the front. In the back, can you stand up for me and turn around so they can see? You can lay it down there if you want. I don't move that out of your way. Thank you. All right, so once again, I'll have you take in a breath in and out through your mouth. Let me know if you get dizzy. It's better to do this with them sitting up, but if you have a bedridden patient, you can turn them to their side and do the same thing, okay? All right, so start here and I'm gonna just listen through here, but you always listen stethoscope to skin, but I'm doing that so I don't have to undress it. Okay, breathe in and out for me. Okay. In. Off that scapula again. Okay, again. 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 There we go. Again. I'm having to feel for scapula since I can't see as good. Okay? Good. Again. Okay. All right, again. Okay. Okay. Again. Again. What did I forget? What would have helped me to know how far to go? I forgot something. Okay, the expansion. And that kinda helps you know, also where to put your, you can listen first, but you'll know where to put your hands. So I know right here is where my sounds were ending. So what I want you to do now, Mr. Ellis, is to take a deep breath in and out for me. And I'm observing my fingers. Go ahead, in and out. Okay, back, and they expanded equally, and they went about that far, so I know that's where the lungs go to. Okay, good job. All right, thank you, sir. You okay?
I'm doing well.
You can sit back down. Should put the step out for you. Reach down back. Okay, we've listened to the lungs. And we've asked them to breathe in and out, and we've done the 10 spaces on the back. And you can either go crisscross, or you can go cross, down. So all lung sounds are clear, and respiration's even and unlabored. No crackles, no rubs, no congestion heard in any lungs. Any lobes. Bilaterally. Okay? Alright, so that is that. I did the heart. Now I'm going to, I tested the capillary refill in the fingernails. Let me start checking his pulses. At this point, I'm taking my gloves off because I can feel that without them. Okay, let me check your radial pulses. And I like to check them at the same time. I've already checked his PMI and his carotids, but if you hadn't, you could do that at this time. Or move it, there we go, there, just don't touch your pulse. Let me come to the side so y'all can watch me. Okay. Put 2 plus there, 3 plus. That's the radials. Radials, I can come up here and try to palpate on these big arms. I'm not gonna probably palpate it. So, okay, radials, that wouldn't be unusual, but I know they're there because my radials are strong, okay? I've already checked his capillary refill. I can go ahead and do a neuro thing here. Squeeze my hands, please. Okay, that's good. And that's equal. His strength is equal bilaterally in his hands. Radial pulses are 2 plus bilaterally. Brachial pulses unable to palpate, but that's okay. All right. Now, what I want you to do, sir, now while we're sitting, is to bend your arms up like this, okay? And I want you to resist me pulling them, okay? Okay? And then bring them out a little bit and resist me pushing. Okay. Strength, good strength in arms, upper, or you could say upper extremities bilaterally, okay? Because what I'm looking for is any asymmetry. Face was symmetrical as well. I don't remember if I said that. So if you forget something, you go back. That's perfectly all right with your checkup, okay? As long as you go back to it. Okay, because sometimes you'll do things that'll remind you of it. Okay, skin. I'm looking at the skin on the arms. It's tan. He's got evenly distributed hair on the arms. A little bit of peeling because I happen to know this patient went out fishing last week because he told me about it. And well, I went with him and we got a little bit too much sun. Okay, and so brown, no blistering, no scary lesions or anything, just regular moles and freckles, okay? And I'm checking the skin here, and as I listened here, I would be checking the skin as well, and also on the back, and just state that when you're doing your checkup. But in real life, I'm gonna be looking at the skin as I'm listening to these lungs, okay?
What would a scary lesion look like?
Asymmetrical, irregular borders, weird color, large diameter, and elevated.
Not necessarily. see anything, I see the usual hemangiomas that he normally has and nothing else different there, okay? And I've also checked the chest, and I've been watching him, and I looked at the skin as well, okay? So I'm still gonna work on the upper body while I'm here before I do anything lower, but I could this time have him take his shoes off and check his pedal pulses. But I like to do everything while I'm here and then have him lay down and do everything else. So what I wanna get you to do is lay down for me, please, again. Okay? And now I'm gonna look, let's take the gown off so they can see a little better. I'm gonna leave him covered though, and I'm gonna be checking, but I'm gonna go ahead and uncover him right now. But when y'all are doing this, just keep your person covered. But I'm gonna check the, you can do it like this, sideways for your patient, if you wanna keep them covered. But I'm watching, looking at the curvature of the abdomen. I'm looking to make sure there are no excess pulsations there, okay? So I'm inspecting first, and the skin looks like the rest of his skin, and it's normal pink for his ethnicity, and his contour is normal round. There, no edema or pulsations noted, okay? Well, it's not really round, it's kind of flat when he lays down, actually. Okay, so,
Thank you.
So, I've inspected, now I'm gonna auscultate his abdomen, and of course, in real life, I'd be asking him about all his down movements and stuff like that, okay, but we're not gonna do that today. Alright, so I'm gonna start in the right lower quadrant, right? Is that correct? Right lower quadrant? Is that how I wanna go, or left?
Right.
Right, okay. So, I'm gonna listen, not through the clothes, I'm gonna move the clothes out of the way, and I'm gonna listen for bowel sounds, okay? Up to 5 minutes if I don't hear anything. And I'll be ready. Left upper. Definitely. Right upper. And left lower, go clockwise. Alright. And I have normal bowel sounds in all 4 quadrants. Normal contour of the abdomen, or round, flat contour. Skin is normal, hemangiomas scattered throughout, with freckles scattered throughout. No lesions, no scars. See, okay? If I saw pulsations here, then I would take and listen in the aortic area for bruit. But I don't see any, so I'm gonna go with that, but you could, if you do that, it's extra, doesn't cost any more. Turn it to the bell and listen. And I don't hear anything, which is good. Okay. Alright, what did I miss? Bowel sounds. Oh, palpate. Yeah, no, well. Alright, I'm gonna palpate on your abdomen, and if you have any pain, let me know, okay? And as I'm doing that, I'm watching his face. Okay? Okay? Okay?
Ouch.
Okay, pain in the left lower quadrant on light palpation, okay? Did that hurt again? Okay.
Yes.
So he had some guarding type pain. About there?
No.
No, okay, okay. And one thing I forgot to do, I would have asked him if he was having any abdominal pain before I started palpating, okay? Alright, that's the abdomen. Now, while I've got him there, I'm going to go ahead and I'm gonna take your shoes off, okay? Or you could have them do it, but I'm gonna go ahead and take his off while he's laying down, and I could have done this at any point in time, like when I was checking the pulses, which is what I'm gonna do now. Okay, socks off, so y'all can see how beautiful his feet are. Okay. Alright, so, I'm gonna go ahead and lift your leg up for me. I'm gonna lift the skin. Now, normally in the hospital, they wouldn't have these on, you'd have them covered up, and I would keep them covered and check each leg one at a time, and check the skin all the way down, okay? And then if they can lift their leg up, fine. If not, if they can't turn themselves, then I turn them over and check that back side really good for any skin lesions. Any sores on your bottom anywhere, any pain there? Okay, any pain in your leg anywhere when I touch?
No.
No pain? Okay. And then I'm going to check both my pedal pulses. And they're good. They're 2+3+ bilaterally, okay? And I'm checking the capillary refill because his toenails are fairly good, okay? I'm looking at the bottom of the feet, no lesions, a little dry heels, but that's usual from going barefoot around here. But no lesions, no broken skin. Checking for swelling there, and then I'm gonna check the posterior tibial pulses bilaterally, see if I can find them. They're hard to feel, but I can palpate them, okay? But I know they're there because of the pedal were good, they were good and strong, and they were strong bilateral. No pitting edema at the moment. The sock's kind of banded on there, but then that's probably not unusual for a lot of folks. I don't see any pitting edema at the moment. Okay, so that's his skin for the legs, and, oh, I know one thing I didn't do. While you're laying here, and see, I forgot something, so I'm gonna go back to it. What I want you to do is flex your feet back, extend them, okay? Wiggle your toes, okay? And can you do your ankles this way for me? Okay, and then the other way? Okay, that's good. And lift your left leg up against my hand, okay? Alright, and the right leg, okay, good. Equal strength in both lower extremities, okay? Alright, let me get you to sit up again for me, please. And I'll help him if he needs it. Put that out from under him. Not bad. Alright. Okay, so now you put your arm back on. Okay, now with your shoulders, I want you to take and roll your shoulders forward and then backward. Okay, and then I want you to stick your arms out for me. And I want you to hold your hands like this. No, straight, this way.
You still like this?
Straight out, okay, and then wiggle your fingers for me, okay, and then I want you to flip your hands over, okay, back and forth. Put your hands to your side and do the same thing, front and back, and then front and back, okay. Now let's see your hands again. Bring your hands both up where we can see them, and I want you to do this, and this too with your fingers. Other hand, please. Okay, so, range of motion good. Now do your hands like this, and the other way. Okay, and do your arm like this. Let me get out of the way, and the left arm. Okay, good range of motion in all joints, okay? Alright, and the shoulders, the, elbows, move in and out, okay? Same thing with the other one, in and out. Okay, and good range of motion in the hands and wrist and fingers. Okay, oh, I know what I need to do too. Okay, now what I need to do is get you to stand up for me, and if the floor is slippery, we can go ahead and put the shoes back on. You wanna put your shoes on now? You put them on. But if you can walk barefoot, we'll do that at the same time. Stand up for me.
Put them on.
Okay, alright, now what I need you to do now is I need you to bend over for me at the waist, okay? And I'm checking for scoliosis. If your patient's unable to get out of the bed, as you're listening for the lungs, you can do the same thing, okay? I don't see any, scoliosis, any lordosis or kyphosis. And stand up for me, and I'll watch the posture and it's straight, okay? And no pain when I palpated? No pain when I touched you?
Nope.
Okay, good deal. Alright, so now what I want you to do is, what I want you to do is take a step forward for me, please. And I want you to get your feet kind of at shoulders width, where it's comfortable. I want you to close your eyes for 20 seconds until I tell you. And I'm watching for swaying. Stop it. Not doing that, please. Okay. What? No swaying noted. He's thinking my time. Okay, so, okay, you can open your eyes now. So the Romberg test is negative, which we want it to be. But as y'all all know, my Romberg test was not negative, right? I did a little sway in there, cause I've got, ear problem. Okay, and then, Now, what I want you to do is to turn around and walk that way a few steps. Just walk normal. I'm checking his gait. Okay, turn around now and walk on your toes back to me. Okay, now turn around and walk back on your heels again. That's good, you can stop there. Gait is, steady and strong, able to walk on toes and feet without losing his balance, so good balance, right? Okay, and did all the range of motion, did the walking, we palpated, and I think, what did I leave anything else out? I did that while ago.
Upper and lower.
Pardon? Yeah, I did that earlier, at the beginning. Huh? Oh, yeah, finger to nose, you're right. Okay, what I need you to do now is to, close your eyes, and then I want you to put your hands out to your side, straight out, and I want you to take your pointer finger and touch your nose one at a time, as fast as you can. So, no, your nose, please. Okay, do the other one, alternating. There we go, very good. All right, you can stop now. Okay, so he was able to do that. One other thing we can do, also turn around and look, let's see, well, I can't see. Is, what I want you to do is to look straight ahead, and as I bring my fingers in, I want you to tell me, I need to stand straight in front of him for this, is tell me when, you see my fingers, okay?
Now,
Now? All right, let's try it
Now.
again. Let's do it this way.
now,
He's got good vision. Okay. Am I doing it right? Okay.
I've got good peripheral vision.
Unfortunately, yes, no, fortunately. Okay, let's see, what else did I do? Okay, I think that's it. What else did I miss? Oh, that one, that coming in that way. Oh, and I need to ask, how many fingers am I holding up?
2.
Two. Okay, now watch. Is it coming?
Mm-hmm.
Okay, tell me when you see it.
See it?
You see it all the way out?
Yeah.
Oh, well, do yours like this. Now bring it in, let's see, do you see them?
No,
Okay, come
I
toward
can
me.
see him right there.
Alright, so we've checked peripheral vision and checked, okay, while looking straight ahead, you can do that. Anything I missed? Y'all got your list in front of you? Did I miss anything?
Anybody see anything that you missed?
Any questions? So see, yours will probably even go smoother than mine because I hadn't done enough practice, so if you don't do enough practice, it takes you
It's harder when
longer.
you're trying to remember what you're supposed to be doing.
Yeah.
But did you notice how she remembered something after maybe she had been in that area? And she said it reminds you sometimes, oh yeah, let me do this. It's because you don't, so much of it depends on your findings. You can do your pulses the way she did them. Most of us are like she did, we do everything while he sat down. You notice she